Recently, I consulted a 50-year-old lady. She came to me with acute lateral elbow pain. The Cosen's test and middle finger extension test proved to be positive. So we confirmed that it's a tennis elbow, and then we started giving the treatment. In spite of 2 weeks of treatment, she did not improve a bit. That's when we thought that there is something fishy. During the initial assessment itself, we found there was a big swelling over the lateral elbow, and she could barely allow us to touch there on the lateral elbow. We referred her to undergo MSK ultrasound scan to identify what really happening in the soft tissues as well as the bones. This radiologist is a very good interventional radiologist. He called me and said me that there is a small partial thickness tear at extensor carpi radialis brevis. That's a muscle that is commonly involved in tennis elbow. The reason why I am discussing this case today is that every tennis elbow is different in terms of severity. Some tennis elbows are not merely inflammation in the tenoosseous junction. Sometimes it can be actually a tear, mostly a partial thickness tear, because hardly we see full thickness tear in the extensor carpi radialis brevis or even longus unless until there's a severe sports related injury or road traffic accident. Most of the time it would be a simple tendinitis due to the microfibrillar rupture, which won't be really seen in the ultrasound scan. They see only the inflammation in the tendon. Sometimes such inflammation become small tears, and then it eventually progresses to become a big tear, and over a period of time these tears, if it is ignored for long period of time, then it becomes a degenerative tear. So most of the chronic tennis elbows which becomes a tendinopathy is a combination of both degeneration, which is nothing but a small tears, which is also accompanying with some form of inflammation. That's why in chronic tendinopathy, it is not right to say that it's only an inflammatory pain. But most of the chronic tendinopathies can be prevented when you address the problem in the acute state. For this lady, we were contemplating PRP, but I'm not a big fan of PRP yet. Can we inject steroid injection into the tendon? No, it is dangerous. It is contraindicated because it's already a tear. You can't risk tearing it further by giving injection in the form of steroid. Can this lady do immobilization? Yes, of course. Ultrasound shows tear. So more than anything else, this lady needs complete rest, probably in the form of shoulder sling immobilization. So that's what we decided, that this lady will undergo some sling immobilization for a month or so for the tendon to get fused. You can't use shockwave there. It is going to cause more pain, and it is not relevant to the current problem. In essence, not every tennis elbow is a simple tendinitis. At times there can be a mild partial thickness tear, or sometimes tennis elbow can be a part of systemic inflammatory condition like rheumatoid arthritis or ankylosing spondylitis. That also you have to keep in mind. That's the reason why diagnostics is so important in physiotherapy. You don't jump into the treatment straight away. You get to know why the pain is there, what is the source of pain, what is the cause of pain, what are the predisposing factors that led to the pain. So all will help you understand to deal the patient better.